Good morning, I am Dr. Rashida. Today my topic is burns. Burns may be thermal burns, chemical burns, electrical burns, radiation burns and lightning burns. Before going to the main topic, I want to tell you about the few salient points about anatomy of the skin. Skin has two layers, that is epidermis and dermis. Epidermis has 5 layers, that is stratum corneum, lucidum, granulosum, spinosum and base. Then dermis is having 2 layers, that is papillary dermis and reticular dermis. The skin has various appendages like hair follicles, sweat glands and sebaceous glands. These pilosebaceous units have most of the stem cells of the epidermis, that is very useful in case of burns. Coming to the classification, the depth of involvement of burns is assessed by degree of burns. The degree is usually classified into first degree, second degree, third degree and fourth degree burns. Second degree burns further classified into second degree superficial and second degree deep burns. How will you assess the depth of involvement of burns in case of any thermal and electrical burns? Depends upon the involvement of the layer of the epidermis and dermis and subcutaneous tissue. These burns are classified into 4 degree of burns. In first degree of burns, the burns involve only the up to the level of epidermis. In second degree burns, it involves the dermal level. So, this second degree burns further classified into second degree superficial and second degree deep burns depends upon the involvement of the papillary dermis or deeper layer of reticular dermis. The third degree burns involves up to subcutaneous tissue. Fourth degree burns usually common in electrical burns that will involve the underlying muscle and bone. What are all the clinical features of first degree burns? First degree burns usually due to sunburn. It is localized to epidermis. It is usually painful, red in color, blanches to touch. This type of burns heals spontaneously with the conservative management. Second degree burns are classified into superficial and deep. Second degree superficial burns involves epidermis and upper layer of the dermis, that is the papillary dermis. It is usually red. The characteristic feature of second degree superficial burn is blistering. So, it is usually painful. It is blanches to touch. Usually heals from intact skin appendages which have the stem cells of the epidermis. Okay. So, it gives some discoloration lightly. Next one is the second degree deep burns. It involves the deeper layer of the dermis, that is the reticular layer of the dermis. It is usually pale in color, mottled appearance, does not blanch to touch, painful to pinprick, heals with the scarring because of involvement of the entire layer of the dermis. So, coming to the next degree, that is the third degree burns. The third degree burns is the full thickness involvement of the skin as well as the subcutaneous tissue. So, it usually appears hard leathery eschar, usually painless. It may be black or white in color or red in color. There is no visible skin appendages. So, it will not heal spontaneously because the entire pilosebaceous units are charred due to involvement of deep burns. So, spontaneous healing in third degree burn is very minimal and it usually needs skin grafting. This picture shows the superficial vein thrombosis, especially in third degree burns. It gives the marbling pattern of the vein. This is the 4th degree burns. It is usually seen in electrical burns. You see the underlying bone was exposed without periosteum. The bone was charred. The surrounding tissue also charred. And this is the 3rd degree burns showing the marbling pattern of the vein. So, this is the one of the method to assess the degree of burn, laser Doppler. This is not using regularly. The clinical examination is enough to assess the degree of burns. So, coming to the Jackson's burn model, Jackson classified the burn wound into 3 zones. That is, the center zone, that is the black color shown in the picture, is the zone of coagulation. So, second layer is the red color is zone of stasis and outermost layer is zone of hyperemia. What is the importance of this classification of zones? So, the black color discoloration, that is the zone of coagulation, shows the irreversible tissue loss due to coagulative necrosis. In the zone of stasis, that is the second layer that has the decreased tissue perfusion, this zone of stasis will become zone of coagulation after resuscitation. If it is inadequately resuscitated, the zone of stasis will become the zone of coagulation. So, this picture shows this is the central zone of coagulation, this is the zone of stasis, this is the zone of hyperemia. If the patient is treated properly, this zone of stasis will become zone of hyperemia and it will become healed properly. If the patient is inadequately treated, this zone of stasis will become zone of coagulation and it will cause us the irreversible tissue loss. This pictorial representation shows this is the adequate resuscitation, the zone of stasis will become zone of hyperemia. Inadequately treated, this will become the zone of coagulation. What happened in before going to the pathophysiology of burns, you should know about the normal microcirculatory fluid exchange. What happened into the normal capillary ends? So, with the normal capillary pressure, the filtration of fluid into the interstitial space partly absorbed by the lymphatics and partly by the venules. What happened in the burns? In the burns, all the capillary end pressures are deranged. So, the absorption by the venules and the lymphatics will be very less because of the damage of the venular end and the capillary end. So, these are all the normal pressure in the capillary ends, that is the capillary hydrostatic pressure is 25 millimeter of mercury, the interstitial hydrostatic pressure is -1 and plasma colloid osmotic pressure is 20 to 28, in the interstitial colloid osmotic pressure is 10 to 15 millimeter of mercury.